Okay, so I'll just start with introducing myself just quickly. You guys know us, but I'm Sherry Little. I'm from the Healthy Living Department, and I am a massage therapist. I also do the craniofacial and sacral massage as well as the sound therapy consultations, which we're beginning next week. And the sound therapy with Carla, we also do every other week, which we'll be doing one next Wednesday, another sound therapy session at 11. So today what we're going to be discussing is upper back pain, which so many students have, and anybody who's working at a computer or sitting on their bed studying, all of those things can really contribute to tightness in the shoulders, the upper back, and the middle back. So today we're discussing mostly the upper back and the muscles that cause a lot of the pain, that trigger a lot of the pain and reflected pain down the arm and into the neck. So the reason why we're going to talk a little bit about anatomy is because if you can kind of visualize where these muscles are in your body and what they move and how they move your body, it will help you do stretches and self-massage and different things, and you can check your posture. All of those things will help you keep some of this pain at bay, and it won't cause you as much problems in your future. You can at least help it periodically each day on your own with stretching, breathing, and all of those exercises. So go ahead, Carla, if you want to introduce yourself.
Hi, how are you? My name is Carla Yorka. I'm a massage therapist in Healthy Living Program. I'm a Reiki master and a sound therapy practitioner. So today, as Sherry said, we are here to talk about the upper back pain. I think everybody has upper back tension all the time. So Maria, can you send me your pantry ID in a private chat, please?
And I'm going to go ahead and share the screen, okay, Carla? So you can go ahead and start. So hold on one second.
Thank you, Maria.
So as you can see, we've named this upper back. Please cut me some slack, because when your upper back is bothering you, it can kind of affect your sleeping and just being comfortable throughout your day. So Carla's going to start us out with our first slide.
Okay, so the common cause by upper back tightness is, well, as I think everybody knows, painful knot, dull aches, pain into shoulders or arm, numbness or tingling, headaches, migraines, and troubles to sleep. The muscles that are involved are upper middle trapezius, rhomboids, Levator scapula, and rotator shoulder cuff muscles.
So I'm going to explain a little bit about the upper and middle trapezius, which the entire trapezius is always involved in most of the things that are happening throughout the upper and middle back. It's a large, flat, triangular, superficial muscle. Superficial means it's close to the surface, close to the skin. It's like the first muscle right under the skin. And it starts at the occiput, which is this bone up here, the back of the skull. You can feel that's pretty prominent. And it goes all the way down. It attaches all the way to the bottom of the thoracic vertebrae. And then it comes all the way out here to the edge of the scapula, which is your wing. And it goes across all the way up. It's a perfect triangle. It's amazing. But this muscle, it helps with the levator scapula. It helps lift the shoulder. It also, with the rhomboids, pulls the shoulders back, which Carla's going to explain in a moment. And it has a lot to do with the latissimus dorsi too. It's connected with a lot of the movement that the latissimus dorsi will do. So when you get a knot anywhere here or in this upper trapezius, it's going to reflect pain down into your arm. It's going to reflect pain all along here up to your head. That's why it can cause headaches and neck pain, okay, as well as the pain right where your knotting may be, which most of the time when Carla and I go to do a massage on this area, we're going to be going right here almost immediately to this upper trapezius, because everybody has knotting here and right in here, okay? The next one is going to be the rhomboids.
Yeah, and also when you have like too much tension, the blood circulation doesn't flow well, and that's why you have like too much like neck pain or also headaches, right? It's because of the circulation doesn't go through your head. Okay, rhomboids. The rhomboids muscle are on the group of the muscle in your upper back. They are located on inner side of your back between your shoulders blade. They attach to the edge of your shoulders blade to your spine. So the rhomboids helps to retract the scapula. So that's the work that they do. I don't know if you can see me well. I think you can see better, Sherry, than me. So that's the. You also, when you had pain in that area in the rhomboids, is because you can have like incorrect posture, or you can be sitting for extended like period of time, or you can have different injuries from straining or overstretching, or also you can have tearing muscles. So if you have any tear muscle with that thing, it's better to go to the doctor to see what serious is the injuries that you can have.
Now I'm going to speak about the levator scapula. This one, it attaches to, it's 4 spots, 4 vertebrae right along the neck. So this is why when this muscle is tight and has knotting in it, you will definitely have pain in the neck, okay? As well as the shoulder right here, all in this upper back and right along the upper trapezius. So the levator scapula is a skeletal muscle situated at the back and side of the neck. As the Latin name suggests, its main function is to lift your scapula. So it takes that little wing and it pulls it up. So if you're sitting at a computer all day like this, and that muscle's contracted all day long, it's going to start to have knots, which are just little teeny, like sticky spots in the muscle. And like Carla said, your circulation will not be good in those areas if there's a lot of knotting and tightness. So that again can cause headaches, it can cause pain, sharp pain or dull pain. It can reflect into your arm as well, and it can go all the way down the back. So by relieving some of the tension in this muscle throughout the day or moving around a little bit more, that will help you tremendously.
Also, the other muscle that is related to this area is the shoulder cuff muscle. This is our compound with 4 muscles make up the rotator cuff, the subscapularis, teres minor, supraspinatus, and infraspinatus. Together, they assist in stabilize the shoulder joint as well as in performing various arm movements. 4 muscles under attached tendons make up the rotator cuff. So these 4 muscles assist to stabilize the joint, the shoulder joint. So those muscles are connected also with the upper back. That's we have it here. And if you have any injuries in these muscles, the good thing that you can do is rest, put ice on it, and do physical therapy. Massages can help you to relieve the pain. The way that we can help that area is massage the neck area, also, of course, the upper back, and then go directly to your shoulder area. Sometimes it's better if you have pain in this area, try to don't go to the gym or do any weight training because that would be worse. And also, thing that you can do is different kind of stretching. Well, that we can explain a few minutes later. But the good way is release the neck area, do a stretching, good way, like good position to sleep. So this is the good stuff that you can do to relieve the shoulder muscles.
So some of the things that we recommend as massage therapists, besides when you're able to come back in and get massages from us, which we cannot wait to do, but until then, you can do some self-massage, which you're going to be able to approach your upper back in several different ways. You're not going to be able to do a lot of self-massage because it's hard to reach, but you can do a little, which I'm going to show you in just a second. I'm going to show you some stretches and some sleep, and talk about some sleep positions that will be helpful, and your posture. So the self-massage, actually, I'm hurting up exactly in the area that we're discussing. So it helps because it helps me know what will help you. But you can come across, for self-massage, you're gonna use your fingertips, okay? And you're gonna press, let's see if they're, okay, I'm gonna try to figure out how to make myself a little bit bigger here, but you're gonna come across and you're gonna press in. If you want, you can pull the shoulder back as you do that. Take your head to the opposite side and pull I'm pulling this way. I'm pulling towards the front of me. And I'm pushing my fingers into that upper trapezius. I'm also reaching far enough back that I'm actually touching a knot that's in my rhomboids that's really close to my wing, my scapula. So you can just press and breathe as you do that, okay? Again, I showed this the last time. You can grab your upper trapezius with your thumb and your fingers and you can squeeze. You can start up by the neck and go out towards the shoulder. You're pressing your thumb into your upper, I'm going like this, into my upper trapezius, all the way out to the shoulder. That may be quite tender, but it will help release it, okay? You can turn your head towards that hand as well. Okay, then you can use this other hand. You're gonna grab with your fingers. You have to use a little bit of energy, but pull towards the front of you like this. And you're gonna resist with that shoulder so you're not coming with it. Okay, you're gonna hold and squeeze and pull. You can turn your head away, turn your head towards it. Grab your upper trapezius at the neck, squeeze, going down towards the shoulder. Turn the head, come back over here because mine's bothering me so much. Good, and if you want to do a little neck, because remember that upper trapezius connects to that bone that's right there at the base of your skull. So you can do a little circular movement around the base of the skull and you're going to feel some relief. And just go right down the sides of the cervical spine, which is your neck. Don't go right on your spine, go just off of it and press in. You can breathe, take the head back as you press in. Okay, you can move your arm around a little bit. Stretch, okay? Those are just some simple stretches, some simple self-massage techniques that you can use. And throughout your day, if you'll just kind of grab these areas and squeeze, it's going to help bring some blood to that area, which will help with your circulation as well. Now, some of the stretches that we have, let's see what we have here. All right, so this first one, you can just put your arm behind you. You're going to turn your head towards your whatever arm you have behind you. Right now I have my right arm behind me. I'm going to turn my head towards that shoulder, and then I'm going to pull my head down. This is getting your levator scapula, the one that is attached to the neck. You're going to also feel it in your middle back and upper back. That's really good. Excellent. Okay, and then the other side, put this arm behind you, turn your head towards the shoulder and pull. That's really good. I've never done that quite like that. It's a really good stretch. And breathe. Then you're going to take your hands out in front of you. Let me turn sideways a little bit. You're going to take your hands out in front of you and pull your shoulders forward. Okay, that's getting your rhomboids, the ones that are right in the middle of your back between your shoulder blades. And pull round your shoulders. Good. Okay. And then the third one, this one here. Whoops. Let me go back. Okay, the third one, you put your arm behind you and you turn your head away and pull down. Okay, that's getting a little bit more behind the neck. That's getting your upper trapezius. Okay. Like that, like so. Okay. Also, some of the things that you can do for self-massage. I do this regularly. I take a ball, okay? The ball, you can use a tennis ball, you can use a racket ball. I use a baseball because my son plays baseball. You're going to put this right in the rhomboids, which we showed you before. If you put that right in those rhomboids and you lay down on it on a mat, like on a yoga mat, not anything too soft, and then you're going to press down, and as you go into that spot that's hurting you, you're going to put this ball so that you can, right on the spot that's bothering you, and it's going to be very effective. You will totally feel that it's releasing things. It may even be a little bit painful, but if you'll breathe through it, it will really, really, really help your shoulder, okay, and your upper back. I do that regularly. So I use a ball. You can use it in your hip. When we get down to the lower body, we will talk about this again. You can also take a foam roller. Okay, this is a foam roller. It's hard foam. You put it down on a yoga mat, and then you're going to lay your shoulders across it. So your back is like this. One shoulder here, one shoulder here. Here's your head. You let your body roll across it, and you open your chest and take your arms behind you as you lay on this. And that's just amazing on the middle back. The entire back. You can roll all the way down to your hips with a foam roller. You can also use, to stretch the upper back, you can use a towel. I've shown you this before on Instagram. Okay, you take it between your hands, like this. You make sure you're standing up and keeping your tummy in. You're going to take your arms behind you and keep them straight, and you go all the way down. You come back up and over, keeping your elbows straight, and go back down to the front. If that was easy for you, you want to really get a real stretch here in the pecs and in the upper back, you're going to bring your hands closer together and do it again. You're going to feel it as you go just past the middle part of the back. That is an excellent stretch. And as you open up more and more and more, you're going to be able to bring your hands closer and closer together. So Carla, if you want, you can discuss this slide that's up here right now as far as the posture.
Okay, everybody knows that if we have good posture, we can prevent muscles pain, right? So the good way that you can have your good posture is stay straight, as the picture show, and that can decrease the pain of your muscle. That you can prevent knot and muscles pain in general.
Yes. I suggest every hour and a half that you just become aware of what is happening with your posture. Take a moment and stop and bring your shoulders down and back. Not way back, just down and a little bit back, because they're probably rolled forward. So if you'll just sit up and breathe and get your head right on top of your spine so you feel the least amount of weight from the head on the spine, immediately you're going to feel your upper back relax a little bit. Your posture is key, and if you don't remind your body regularly that, oh, I'm holding, I'm gripping, I'm rounded, if you don't do that regularly, by the end of a 4-hour period, you're going to have trouble moving. So just start moving around a little bit more, and you're going to help relieve a lot of the pain that you're suffering. I'm going to stop the sharing of this, and if anyone has any questions, you can either put them in the chat, or you can unmute yourself and just go ahead and ask us if there's anything you'd like us to help you with the upper back.
Where I can buy the roller that you have behind you, where I can find that?
Usually you can order them from like a sports place like Dick's or any place.
Amazon has everything.
Amazon?
Yes. Massage.
How do you call it?
Massage roller, right? Massage roller foam.
FOAM foam roller.
Okay.
Mm-hmm.
Perfect. Thank you.
And I know. So I don't know if Marshall is open, but I know that Marshall have it too, and Rob's.
They open, but I order Amazon better.
Yeah, perfect.
Thank you.
And if you ever need help how to use it, just, you can always, you know, contact us, and I'll try to help you, I'll talk you through that.
Oh my God, thank you. As soon as I get it, I'll let you know. I'll let you know, guys.
So, anybody else have any questions that we can help you with?
I think someone in the chat asking a question.
Okay. I wanted to also talk about sleep positions. How you
Oh.
sleep.
Oh, see, we don't have the answer. We don't know yet. She asked, do you think that you will guys be open for appointments again?
We can't wait.
Some, we don't know.
We're not sure yet. But as soon as we can do it, we will be in there. Carla and I can't wait. We want to do it. And we just have to, you know, get the okay to start. Let me discuss for 1 second the sleeping positions. For your upper back, it's the same as what I discussed last week. You want to make sure your head is not on a pillow where it's at an angle. If your neck is at an angle, you're going to wake up with neck pain. If your arm is up under your head for 5-6 hours during a hard sleep, right, you're going to have upper back pain and you're going to have shoulder issues. So try to sleep. If you're going to be on your side, have your arm down and out in front of you. Okay, so there's less pressure on your shoulder. You can hug a big pillow and make sure your neck and your head are all supported. If you're on your back sleeping, that's the best way to sleep. You can even have your arms up on little pillows on the side. That helps keep your arms from hanging back and pulling on the shoulder and upper back. And when you're sleep, we're going to get to the lower back in a couple of weeks, but you want to have a pillow between your knees as well if you're on your side.
Yes, Silver, if you sleep with your arm under the pillow, it's not good. I know, because I sleep in the same way. I'm trying to change it, but I can't change it. Every time when I woke up, I'm in the bad position.
You know, I see a sleep system on Facebook. I don't know the name of it, but you can search around for it, where there's like this raised up, like, whatever it is. It's like a pillow type of thing.
Okay.
Hole, right? You put your arm through, if you like sleeping like that, you put your arm through this, but there's not going to be any weight on your arm, and you sleep on it. Like, it's pretty cool. It's a very smart invention. It's made for shoulder cuff issues. So look around for that. It's a little expensive, but I think it would work.
So Silver, that's what we need.
Yeah. Anyone else? Oh yeah, you've seen it, Yanya? Uh-huh. I'm tempted to buy it, but it's like $300. So not right now. Oh, pregnancy pillows. Well, pregnancy pillows, I think, would be great. Oh, Silver, I know. I thought you had something new to tell us. Oh my gosh. I think a pregnancy pillow would be helpful, even if you're pregnant.
Especially lower back.
Sorry, Carla, go ahead.
No, for the pregnancy pillow is good for lower back pain.
Yes. And did everyone leave their, we're just making sure that everyone here has left their Panther ID in a private chat to Carla, if you could. So next week, thank you. Oh, Yanya, thank you. Next week on Wednesday at 11, we will be doing another sound therapy session. And then the following week on Wednesday, we will be discussing arm pain and numbness. And we're going to be giving there's some really cool self-massages you can do for your arms. And because they're easy to access, right? It's easier to get to them. So we will help you with that on the next one in 2 weeks. And I believe, just be watching, we are going to start having 2-on-1 sound therapy consultations. If not next week, maybe by the end of the week. So be looking for that. You can make an appointment for those. And we can be a little more personal with each person, okay? Carla, do you have anything else to add for today?
No, thank you everyone for being here with us and support.
Yes, thank you for coming. We're so glad to see you and can't wait to see you in the office soon. Bye, everybody.
Bye, thank you.
Thank you.
Bye.
Bye.